Good evening, everyone. I'm Avi Kapoor. I'm today's host on the behalf of the internal event coordinator at Bioethics Unit. Today, we are going to start and learn this topic of consent. So I would love to congratulate you all for being selected for this session. Since only few people have been selected, so please do focus on this event, and you have been selected on the basis of the answers that you had been submitted to the forms asked earlier. So over to Alia, who would be introducing us to the speaker of the event. Thank you so much, sir, for joining on time, and it's a great pleasure to host you. Over to you, Alia.
Good evening, everyone. Congratulations, everyone, first of all. And okay, sir, it's an honor to host you. We have Dr.Sandeep Kadu, sir, with us. He's M.B.B.S, M.D. in F.M.J, D.N.B, and PhD scholar. He's the professor and the HOD of forensic medicine in DVVPF Medical College, AHMEDNAGAR. And sir has started the first digital forensic medicine museum in India, and was also recently felicitated with MUHS Best Teacher Award. So it's a pleasure to host you. Thank you so much for joining us today. And this is such a critical topic, consent in medical practice. So I hope you all, our audience, enjoy this session, and please listen carefully because it's something really important and we really need to focus upon being medical students.
Good evening. Am I audible?
Yes, sir, you're audible.
Okay. Good evening, all of you. At first, I'm very thankful to organizing team, Dr. Akruti Ganla, as well as my brilliant student Arama, for giving me opportunity to deliver session on this important topic, that is consent in medical practice. I'm very thankful to Avi Kapoor as well as Alia for my introduction. First, what is consent? Consent is a broad term. So I'm focusing consent in the aspect from our country, that is India. So we follow different acts which is enumerated in our constitution, that is Indian Penal Code, IPC, Criminal Procedure Act, and so on. Actually, consent is not defined in our constitution, but it is defined in an Indian Contract Act. What is consent? Consent is free and voluntary agreement or approval or permission for compliance of some act. That is the definition which is given under Indian Contract Act. So all these words are very self-explanatory. Consent should be free, means it should not be under pressure. It should be voluntary, that the person should give voluntary it, then and then only it is valid consent. So for what? Free and voluntary agreement or approval or permission. For what? For compliance of some act. So that is the consent. And it is defined under ICE, that is Indian Contract Act. Why consent is important? In our day-to-day life also, as even our closest friend is there, and we take a pen from him without his permission. So what is it? Why you have taken my pen without my permission? So in our day-to-day life also, we require permission or consent in a legal term for any small act. Otherwise, we feel guilty or other person will feel bad. So that is related our day-to-day life. So under Article 21, we have given autonomy. It's a very important privilege given to all of us by our constitution, that is Article 21. So we can refuse the consent. If we feel, no, it's not for my benefit, we can refuse that act. But in emergency, the consent can be taken for the good faith. I'm going to explain what is important in an emergency. So what I said, that consent is important and it has legal as well as ethical values. I already explained you. For small things, we have to take permission. Even in a classroom, we have to enter, we have to take a permission of a teacher, like this. So for these small things, we are using this permission, and in a legal term, it is called as a consent. Now, as a doctor, we are dealing with a live patient, with the body of that patient, and we are dealing with the treatment. If with that treatment is benefited, then we have to take the consent of the patient. Without doing anything, without taking the consent, it is the crime. Remember, my friends, even if it is the benefit of a patient, but if you have not taken the consent, is the crime. There are many cases. There are many cases in literature that in a good faith, doctor has operated to save the life of the patient, but he has not taken the consent, proper consent, and doctor was held liable for that. So that's the importance of the consent. And whatever the thing, now the days have changed. The patients are well educated. Whatever you tell, they will cross-check on Google. Google is another doctor now, upcoming doctor to compete for the competition for you. So they will cross-check whatever the doctor is saying. Also, they will cross-check or take a second opinion. So for that reason, you have to take a proper consent. And if you have that informed consent with you, it will be a good defense. If unfortunately any negligence case will lodge against you, then the consent is very important. That's the importance of the consent. Now I'll proceed. What are types of consent? There are two main types, that is implied consent and express consent. Express consent is again of two types, verbal and written. So I will give you an example, and in many books the example is given. If the patient comes to your clinic, it is implied that he has given you consent for the examination, for the clinical examination. So that is implied consent. No necessary to take a written consent or a verbal consent, because he has to, with his own, came to your clinic. Means it is implied or his conduct or his behavior has given you consent for the clinical examination. But in a female, if doctor wants to do the per vaginal examination, at that time, the male doctor has to take two precautions. One, some lady attendant must be there. And second, he should or she should take the verbal consent of that female. So that's the important, that's the example where the verbal consent is taken. Next, if the doctor feels that small procedure he has to conduct for a proper diagnosis, or small procedure has to be conducted for the emergency treatment, then he has to take the written consent. How the written consent is taken? In further slides, I'm going to explain it. But time being, you remember that implied consent with the patient's conduct or only for the clinical examination, it is sufficient. Verbal consent for any private part examination or other examination, the verbal consent is taken. But for any operative procedure, even intracat, you want to put an intracat, it is better or it is on a safer side, you have to take a written consent. Now, my friends, in a last sentence of my slide is the blanket consent, and it is the invalid in a court. And if you observe or if you have seen in many hospitals, still this type of the consent is taken. And when this type of the consent is produced in a court, it has no value at all. Because what they have taken, I authorize to carry out so many tests, so many procedure, and that surgery means, one sentence, all these things has taken. Means the patient has come to your hospital and he has given all whatever you want to do. That's not the way to take the consent. And this type of the consent is known as a blanket consent. And you, as a brilliant student, as a good medical practitioner, never take a blanket consent, and consent should be procedure specific. Means if you want to do intracat, you have to take a consent. Again, if you want to do another procedure like a blood transfusion, again you have to take consent. Again, if the surgery is needed, for that particular surgery, you have to take consent. Again, in a surgery, if you found that there is another complication and you have to, if you have opened for the appendicectomy, and you seen that some part of the intestine is also gangrenous. In that case, but you have taken consent of what? Consent of remove the appendicitis. But after in operation, you felt that you have to remove the small part of the intestine also. Again, at that time, it's not possible to take a consent of that person, but you have to take consent of the relative, near relative, which is that. I thought that there is acute appendicitis, but the infection has reached to the intestine and I have to remove the small part of the intestine also. So you have to take again a specific, another consent to remove that small part of the intestine also. So my friends, my dear students, it should inculcate in your mind that for every procedure, you have to take a separate consent and never take a blanket consent. Have understood? It's a very important point. You can say that is the heart of or is the keynote of my lecture. So you have to take consent for and it should be procedure specific. Never take blanket consent. It is not valid in a court at all. So what are essential ingredients of the consent? So consent should be directly and personally given to the person who needs it. Means patient has to give the consent to the doctor. And again, I have explained it should be voluntarily, without any burden or without any other incentives. So it should be voluntarily, and after understanding the nature, quality, and consequences of the act which the patient has to go through. And fourth, it should be preferably in patient's local language. So I'm from Maharashtra, it should be or if the patient is well educated, you can take in English. But preferably, it should be in Marathi, because other relatives also should understand. Or if you are from other state, from Tamil or whatever your mother tongue is there, in which language the patient is comfortable, or that local language, you have to take the consent. These are the very important ingredients of the consent. So it should be directly and personally to the person who needs it. It should be voluntary, it should be free, and it should be after understanding nature, quality, and consequences of that act, and preferably it should be in a patient's local language. So where the consent is invalid, I also told that fear of injury. So someone near, dear, one and is there, and that there is fear of injury to that person, and if the consent is taken, it is usually applicable for that rape cases. That consent is not at all valid. Misconception of the fact. So whatever you are told about that surgery and whatever the patient has understood, there is communication gap, or in a rape, it is given that the husband, whatever they see, thinks that he is the husband, but the person is another person, is not actual husband. That is the misconception of the fact. Third, given by insane person, so is not able to understand. So these are the circumstances where the consent is invalid. Also, intoxicated person means he is intoxicated under alcohol or other drug habitual like ganja, charas, like that. If he is intoxicated, that consent is also not valid. So these are the circumstances where consent is invalid. Important consent is the informed consent, and it is the very important written document by a doctor while doing any procedure. Always take informed consent. Informed consent is the part of express consent. Express consent is of two types, verbal and written. Written consists of informed consent. So what are the ingredients of the informed consent? So in that, there should be adequate disclosure of the information. Patient has to give freedom of the choice. It should be his or her understanding, and he should have the capacity to make a decision. Then, what comes under the disclosed information? What information as a doctor we have to give to the patient about any procedure or treatment? The first and foremost, you have to put whatever the with his clinical examination. At first, he has to take history, then he has to do the physical or clinical examination. After that, some investigation. After all that, he comes to the diagnosis. So he has to tell or give a proper time to the patient, tell that with your history, whatever I have done your clinical examination, some investigation has made, and I have reached to this diagnosis. With this diagnosis, there are different modalities of the treatment. Each treatment has its pros and cons. So you have to explain. So this is the treatment. Surgery is one of the treatment, but it has its some adverse effects. Then other, it can be treated conservatively, but it has also some disadvantage. So you have to explain all things, tell the patient or his relative to think on it and tell what treatment you prefer. Many times I am at a rural area, many times the patient tells, doctor, you have that knowledge and you take decision. You take decision because we don't have knowledge, medical knowledge. Whatever you feel is better for us, you can do or do the operation or give that conservative treatment. But if that patient is well educated, again, he is anxious about that. So give him or her a proper time. Also, you can say, you can take a second opinion, do or discussion with all your family members. Then you can come tomorrow and tell what treatment of the choice is of yours. But in emergency cases, I am going to come that you have to treat the patient for the good faith or to save the life. But these are the ingredients of disclosed information, or how the informed consent must be taken, or what are the ingredients or what information should be told to the patient. Circumstances where the consent must be obtained. These are the circumstances. All cases of the medical examination and treatment, I already told, when the patient comes to your OPD, take implied consent that he has given consent for the examination. But if you want to do a private part examination, you have to take verbal consent. If you want to do some procedure, you have to take a written consent. Investigation and treatment beyond your usual procedure, like you want to give the blood transfusion, then you have to take the consent because there is risk of a hypersensitivity reaction. Even if you want to take or do the simple cath insertion, in that also you have to take because there are the chances of the bleeding. Especially it is important in pediatric age group. Before examination of the medico-legal cases, you have to take the consent. An important examination of victim of a sexual assault. Remember, victim of a sexual assault must be examined after only her consent. If she doesn't give consent, you should not examine. And the accused of a sexual assault can be examined without consent. Also, you can apply a reasonable degree of the force with the help of police officer. So it is applicable for accused, but for the victim, you have to take the consent. And for accused, you can examine without the consent. Even also you can apply a reasonable degree of the force for the examination. That's the difference between the victim consent and the accused consent. Also, many times during the history or during clinical examination, patients tell you their secret. And that secret, as a professional secrecy, you should not divulge anybody. But if the court asks it, and it's for the patient benefit, you can divulge the secret of the patient. Also, in a better or for a defensive type or for your safety, if your sixth sense says that for this procedure, I require consent, you have to take the consent. So on your safer side, take the consent. What it require? You have to write 3 or 4 lines in a patient own language, but take that consent. You will be safer. Also, you don't have tension as well as anxiety for doing that procedure. Consent is invalid in criminal act. Very important thing. Many times that for the criminal act means I will give the example. What is the definition of the injury? Injury is any harm, whatever illegally caused to person's body, mind, reputation, and property. That is the definition of the injury. We also do the injury, or we also take an incision on the patient. But is it injury? No. Why? Because before taking incision, we have taken the consent. So that's the difference. Understood? So we also take an incision, but we take an incision after taking the consent. If we have taken incision without the consent, it's the criminal act. Also, for the many times that you will come across during your future practice that we have taken a consent for that act. So I always say to my student that the person that he has given consent for the stabbing or what. So all this for the criminal act, the consent is not at all valid. Is it clear? So only husband or wife consent is required in a for the routine procedure for any operation like appendicitis. But if some oophorectomy has to be done, so it may lead to the infertility or other problems. That case, both that husband as well as wife's consent is required. So it should be remembered for routine operations. the only husband or wife's consent is required. But if the risk is involved for the loss of potency or infertility, in that case, both husband and wife's consent is required. So patient cannot be detained against his or her will. Remember. So you have to take, in that case, the patient does not want, you have told him, convince him, you have to get admitted in the hospital, you require 3-4 more days, but patient is not willing at all. At that time, you can take well-known, that is the D.M.R.E, that is the discharge against medical advice. So you have to write that I have advised so and so, but patient is not willing to admit in my hospital, and he is going against my advice. That is known as D.M.R.E, that is discharge against medical advice. Consent of the guardian. So I'll explain. When age between 1 to 12 years, always for any procedure, anything, and I'll we are here that I already told you, patient cannot detain against his or her will. And if you want to discharge from the hospital or don't want to take the treatment, in that you have to take in a written. And for discharge, it is called as a D.M.R.E, that is discharge against medical advice. Then consent of a guardian, that I'm telling, that from first year to 12 years, whatever the treatment or whatever the clinical examination, you have to take consent of a parent or guardian or near relative in case of the children. Between the age 12 to 18, remember, between the age 12 to 18, that child can give the consent only for the clinical examination. He is not legally permitted to give the consent for the surgery or any other procedure where the risk of a or life-threatening risk is involved. And above 18 years, that person or that adult can give the consent to suffer any harm or which may cause death or grievous hurt under 87 IPC. Again, I am repeating, from the age first year to 12 years, consent must be taken from the parents or guardians, or in case of street children or orphans, the consent is taken from the court. In case of a street children and orphans, their guardian is a court. So like this, from first year to 12 years, the consent of a parent is required. From 12 to 18 years, that boy or girl can give the consent for the clinical examination only. But for operative procedure or any other procedure where risk is involved, he or she cannot give the consent. Consent is taken from the parent from 12 to 18 years forward for any surgery or any other procedure. But I have already, now there is one word, remember, what is assent? So as Article 21 has given autonomy to every person for that he or she can refuse. So for any procedure or for any operation, the boy or girl between 12 years or 18 years, he cannot give consent, but you have to take assent of him or her. You have to tell that you are going to do that procedure on him or her. But legally, it's not valid. But as you are doing procedure on him or her, it's your duty to tell him or her That's this procedure you are going to do that. And it is known as an assent. And assent is applicable for the 12 years to 18 years, and it's for the procedure. And you have to consent of a parent. Is this concept clear of assent and a consent? And above 18 years, that person is mature enough, he or she can give the consent for the procedure or for the save the life, or it may have risk which can cause death or a grievous harm. Is it clear? Then 88 IPC, act not intended done by consent in a good faith for a person's benefit. For example, unconscious patient has brought to your hospital and it's the accident case. That person is not able to give the consent. No other relatives are also not there. The another third person, third party or third person, any social worker has brought it. And you think that you have to do the emergency operation of that patient to save his or her life. In that case, without consent, you can do the operation, but it should be for the benefit of that person, and it's good faith. Good faith is very important. So this 88 IPC is where the doctor has to do the procedure or any operation without the consent of the patient, because consent is unconscious or in a coma or intoxicated. In that case, if you want to save the person's life, you have to do that operation or that procedure to save the life, and you are not held liable for that because you have done in a good faith. What a good faith? That you want to save the life of that patient. So without consent also, you can do the procedure to save the life of that patient. Have understood all these things? So I already told, person unable to go in an emergency condition, you have to do the operation without the consent. Then many times you have to prepare a report of an intoxicated person. And you know, I already told, the consent given by intoxicated person is not valid. Then the person who brought that person to the hospital, at first you can take the consent of the patient, that relative or that person who has brought that intoxicated person to your hospital, take his or her consent, start doing the clinical examination, start giving the treatment, and after that you have to prepare a report of a intoxicated person. But that report should be submitted to the police when that person comes in a normal condition, and you have to tell that when you brought to our hospital, you are in intoxicated. I have taken the consent of that third party who has brought to you, but now you are in a conscious state, you know all the circumstances. Now I have prepared this report and I am submitting this report to the police officer, and this report may go against you, but you have to submit it and take a consent when that person, intoxicated person, comes in a normal condition. Adult can give the consent for the transplantation of the organ. You have heard that the kidney transplant or the skin transplant, like that. The adult means above 18 years of the age. The consent is given for the organ transplantation. Even if next the person in its lifetime has given consent that after death he has to donate the body or organs can be donated, but remember, after the death, the body or the owner of the body becomes her legal heirs, like son, daughter. And to remove the organ from the dead body of that person, you have to take a consent of the son or daughter. Without their consent, you cannot remove the organ from the dead body, even if that person has given consent to remove or donate the organ after his death. Remember, even his lifetime, he has given consent to donate that organ, but after the death, the owner of the body becomes the legal heirs, because son, daughter, wife, brother, sister, and you have to take the consent of that near relative, and then only you can remove the organ from the dead body. It's very important. And there are different types of the post-mortem examination. That is, first is the academic post-mortem, that is done by anatomy department. It comes under the Anatomy Act. Second is the medical legal post-mortem, that is done by my department, that is forensic medicine department, and to do that, no consent is required. And third is known as a clinical post-mortem examination. It is done for academic purpose, that the person has died, no cause of death has, physician doesn't know why he or she has died, and for academic purpose, what is the cause of death? For that only the post-mortem must be done on. That is known as a clinical post-mortem. But for the clinical post-mortem, you have to take the consent of the legal heir, like that of the son, daughter. If they give the consent, then only you can do the clinical post-mortem. Otherwise, you cannot do the clinical post-mortem. So for a clinical post-mortem, and this clinical post-mortem is done by a pathology department. So the anatomy department, that dissection is done by anatomy department, medical legal autopsy done by my department, that is forensic medicine department, and clinical post-mortem is done by pathology department. But for the clinical post-mortem, consent is required of a legal heir. Is it clear? Now, the important thing, consent for the sexual act. So previously, our Constitution has given that below 16 years of the age, that person, he or she, can give the consent for the sexual act. But you all know one very unfortunate case has occurred in our country, that is the Nirbhaya case. And after that, all has thought about that, and the age of a consent for the sexual act has been raised from 16 years to 18 years. Now it is not a 16 years, it is of a 18 years. In a 2013, the age of giving the consent for the sexual act has been increased from 16 years to 18 years. As we are dealing with this Asian Students Medical Association, that is ASMA, that is the India division, there are different, from Asia, there are different range of age where the consent for the sexual act is given. It ranges from 11 years in MN up to 21 years. So in a different countries, the age of a consent for the sexual act has its own range. That is, the minimum is 11 years of the age in MN country, and it will up to the 21 years. In our country, that is in India, consent for the sexual act, previously it was 16 years, but in a 2013, it has been increased from 16 to 18 years of the age. Now, my friends, I conclude that consent, what is consent? Consent is free and voluntary agreement, approval, and permission for the compliance of the act, and it is defined under Indian Contract Act. Then what are types of the consent? There are mainly two types, that is the implied consent and express consent. I have already explained about what is implied and what is expressed. Express may be verbal or written. Consent is a very best defense of a doctor for in a negligence cases. Consent must be procedure specific. It should not be blanket consent does not have any value in front of the court. It is invalid. Why? You have to take a separate consent for a separate procedure. And I enumerated different circumstances where the consent must be taken. What are the ingredients of the informed consent? What should be written? Consent must be taken in patient's own local language. Always take the consent for each procedure. And lastly, consent, how informed consent must be taken. You can watch, I have only 3 minutes video is there. I'm going to play that video. This is from a Marathi film, but there are subtitles out there. You can understand what message I want to give. The grandfather of a child having cancer, or that is retinoblastoma, and that doctor want to remove both the eyes, and it's very emotional or a very embarrassing situation in front of the doctor. How to convince to the grandfather? You can watch this clip, and with this you can understand how ideal consent must be taken.
हॅलो, हा बोल. नाही, उद्या स्क्रीन आहे, गुरुवारी आहे, APR गुरुवारी आहे.
Can you hear the audio as well as can you watch the video?
Okay.
Yes, sir.
परशुराम साहेब
बसलाय ना जागेवर. तू कशी काय ओळखतेस काय?
सर, कालच हॉस्पिटलमध्ये सिटी स्कॅनच्या इथे आमची ओळख झाली.
बरोबर.
सर
असं तू बस. हॅलो, किती पेशंट आहेत? बरं, पुढच्या 10 मिनिटात कोणाला सोडू नकोस आतमध्ये. हॅलो, हा देशमुख बोला. उद्या 7 वाजता आहे ना? हो, या ना. हो, रिपोर्ट घेऊन या. ओके. बोला. चहा येणं पडा? नाही, नको. घ्या ना, मी पण घेणार. अर्धा चहा पाठवा. परशुराम कुठे आहे? बाहेर बसवलाय. एकटा आहे का? नाही, बरोबर आहे. सुनेचा भाऊ आहे. बरोबर, ठीक आहे. असं घाबरण्यासारखं काही नाही. आणि घाबरून काही होतं का? आपल्याला शांतपणे सगळ्याचा विचार करायचा. थोडीशी अवघड आहे. ऑपरेशनच करावं लागेल ना? हो, ऑपरेशनच करायचं आपल्याला. नंतर त्याला दिसेल ना? सांगतो, सगळं नीट समजून सांगतो मी तुम्हाला. नाही, ऑपरेशन करा तुम्ही. खर्चाची काय काळजी करू नका. झाडमळ विकीन, ते बघीन काय करायचं नाही. प्रश्न पैशाचा नाहीये, त्याची काळजी करू नका तुम्ही. सांगतो ना, तो प्रश्न नाहीये. या चहा घ्या. हे बघा, आपल्याला दोन्ही डोळ्याचं ऑपरेशन करायचं. पण दिसेल नाही. आपल्याला परशुराम सगळ्यात महत्वाचा आहे की नाही? हो की नाही? मी सांगतो तुम्हाला समजवण्यावर. आपले डोळे बाहेर गुगुळ असतात ते काय, त्याच्या मागे हा रेटायना असतो, त्याच्यामुळे आपल्याला दिसतं. या नर्व्स असतात मागे, ह्या जंक्शनला इथे त्याला कॅन्सर झालेला आहे. त्याला डोळ्याचा कॅन्सर म्हणतात. बाबा नीट हे बघा बघा माझ्याकडे बघा बाबा हे बघा या दोन्ही डोळ्याच्या मुळाशी कॅन्सर झाल्यामुळे आपल्याला दोन्ही डोळ्याचं ऑपरेशन करायला आहे. आत्ताच जर केलं तर आपल्याला उपयोग आहे, कारण पुढे हा कॅन्सर जर शरीरात पसरत गेला तर आपल्याला काही करता येणार नाही. म्हणूनच आपल्याला ऑपरेशनचा निर्णय लवकरात लवकर घ्यायचा. दुसरे डोळे बसवता येत नाही, एक बसवलं तर चालेल. अहो ह्या केस मध्ये ते शक्य नाही. ऑपरेशन करावंच लागेल लवकरात लवकर. दुसरा काय उपाय नाही का बाबा? सगळा विचार करूनच मी तुम्हाला निर्णय दिलाय. आणि सुदैवाची गोष्ट म्हणजे हा कॅन्सर पहिला स्टेजचा आहे. ऑपरेशन केलं तर आपल्याला काही प्रॉब्लेम येणार नाही. त्या ऑपरेशन नंतर त्याच्या आयुष्यातला एकही सेकंद कमी होणार नाही हे मी तुम्हाला सांगते. पण वेळेस आपण ऑपरेशन केलं तर लाखात एखादी केस आहे दोन्ही डोळ्याच्या कॅन्सरची. वर्ष सुद्धा लाखात ऑपरेशनचा निर्णय तुम्हाला घ्यायचा आहे ना? काय द्यायचं घरच्यांशी बोलून बघा. आता करा ऑपरेशन ताबडतोब, असं काही नाही. तुम्ही घरच्यांशी बोला आणि 2-3 दिवसांनी मला सांगा ना, काही प्रॉब्लेम नाही.
बाबा तुम्ही जरा शांत
बाबा 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 एक मिनिट बाबा, एक मिनिट बसा बसा, शांत व्हा शांत व्हा. हे बघा आणखी एक महत्वाची गोष्ट हे लक्षात घ्या बाबा. कुठलाही ऑर्गन काढताना किंवा शरीरातला भाग काढताना पेशंटला पूर्वकल्पना द्यायला लागते. नाका खाद्यावर टाकू माझ्या. प्रयत्न करा ना, प्रयत्न करा. तुम्ही नाही, हा प्रयत्न तुमचा तुम्हालाच करायला पाहिजे. पदरात टाकले तुमच्या, काही काळजी करू नका. ऑपरेशन नंतर काही प्रॉब्लेम येणार नाही. ओके, केलं तरी चालेल. मला तुम्ही निर्णय कळवा. मला ते येऊन दे आणि पेशंट पाठवा.
Again, I'm very thankful to Dr. Akruti Kanla ma'am, Association, Asian Student Medical Association, Dr. My student Dr. Arama, Aliya, Avi, thank you for giving the opportunity. If you have any questions, you can ask.
Thank you so much, sir. I'd like to ask the audience if they have any questions. You're free to ask right now. You can even write in the chat box.
Sir, I had a question.
Yes.
I wanted to ask, when a patient gives a verbal consent to a doctor, and in some case, like if a patient do accuse the doctor wrongly, then what defense does the doctor has?
Yes.
If only verbal was given, verbal
Yes.
consent.
Yes. If you have taken, that's the problem. Because the court wants evidence. And when the verbal consent is taken, and there is no third party to give the evidence, no, in front of me, that person has, or that patient has taken the consent, we cannot help. So it is always better that we have to take a consent that is the informed written consent. In that case, we become helpless.
Okay, thank you, sir.
Thank you.
All right. So since none of you have any other questions, so sir, I would like to ask you, everybody at least, to switch on their cameras so you can stop sharing the screen, and then we can have a group photograph over this virtual platform before we give you, sir, a vote of thanks for your presence. So everybody, I request everybody who's there online, please switch on your cameras. This is necessary for the certificate. So even if you don't have a virtual background, just put it on. We would love to see your lovely faces. All right. So I'm having 2 slides over my screen. So we'll be having it in 2 groups. So everybody smile. 1, 2, 3. And for the next group, in 3, 2, 1. All right, sir. So we are over with this. Thank you so much, sir, for your presence. It had been a wonderful presentation. None of our FMT teachers could present it any better. The video part was a special touch and a cherry over the cake. So we look forward to work with you in the future. And thank you so much for your presence, sir. You may continue with your job. Your job here is done. Thank you.
Thank you. Thank you. I'm also happy with work with you. Thank you.
Thank you so much, sir. All right, as far as the contestants are concerned, we'll be sharing the post-event form in the chat box of the Zoom. So please fill those forms because that is also necessary for us to facilitate your certificates. And we will be opening the form only for next 10 minutes. So make sure you complete the form before you leave this group. Thank you so much. Have a wonderful day ahead. Bye-bye.
Bye.
Everyone, please fill the form within the next 10 minutes. I've sent it in the chat box.